Hello and welcome to PMC TV. We're excited to show you some of our services and the things that make Portneuf Medical Center a world-class hospital. As we begin, here is a message from our President and CEO, Dan Ordina.
Welcome. My name is Dan Ordina, and I'm the President and CEO of Portneuf Medical Center. We're honored that you have chosen Portneuf for your care. Our mission here is world-class care, every patient, every time. For the next 30 minutes, we want to tell you our stories about our talented and compassionate team of care providers. We offer a wide range of specialized services, from cancer center treatments to open heart surgery, but also the small things that matter in your overall experience, like room service and valet parking. You really have chosen a facility of world-class care. We're the only hospital in Eastern Idaho recognized by the Joint Commission and U.S. News and World Report as a top-performing hospital. The Portneuf team wants to thank you for entrusting us with taking care of you and your family. We hope you enjoy the program.
Thanks, Dan. Well, there are many reasons for our community to be proud of Portneuf Medical Center. We're a world-class hospital doing state-of-the-art procedures, but it's our commitment to safety and quality that made the most recent announcement very exciting. Caitlin Lukitas has our story.
When I first met Dr. Jacob De La Rosa, he brought a man back to life whose heart stopped after falling in a freezing river. Nearly 2 years later, he's representing one of the nation's top hospitals.
We look at the Cleveland Clinic, the Mayo Clinic, we look at major programs, and if they can do it, then we can do it as well.
Today, the Portneuf Medical Center announced it received an award, recognizing it as a top performer in key quality measures.
There's just quite a bit that people have to do to make sure that people are safe when they receive care, and it does. It takes a huge team to make that happen.
Portneuf CEO Dan Ordina says this just means the nation's Joint Hospital Commission recognizes Portneuf patients to have a higher chance of recovery than other hospitals. He says the award's based on 4 key qualities: heart attack, heart failure, pneumonia, and surgical care.
35,000 people come through our emergency room every year. And so when they present with chest pain, the number one thing that we've got to do every single patient is provide an aspirin. And then that's recorded and reported to the federal government.
De La Rosa says the hospital's been leading the way in technology advancements as well, but his biggest secret to success:
Treat others as you want to be treated.
which sounds simple, but in the end, saves lives.
And that's really, how you can sleep at night, is knowing that you've done your best job. And I think it's really shown now by being recognized, at a national level.
In Pocatello, I'm Caitlin Lukitas.
Losing weight and, more importantly, gaining a healthy lifestyle is the goal of Portneuf Medical Center's Weight Management Institute. Reporter Jenny Lucy caught up with one of the success stories.
For the longest time, my weight has gone up and down, and as I get older, I realize I have much more that I want to do in my life, and I think my heavier weight was at a disadvantage.
Rick Gibson is a case manager and medical social worker at Portneuf Medical Center. After struggling with being overweight for many, many years and trying method after method of weight loss, Rick turned to someone he knew and trusted. Rick went to go see Dr. Alan Gray, and together they decided on a plan of action.
They tell us very early on, one of the parts of the program is you spend 6 months being taught how to change your life, how to eat better, how to pay attention to your habits, both good and bad, and how to affect change there, because I envision the surgery as just a little blip in that whole process, a 5% of 100% process. And so all of that teaching was very important. The best thing I found about this program is that it actually wants you to be in that program for many, many months and learn habits, develop a better way to live your life, then have the surgery and already have those habits in place.
The results were just what Rick had hoped for.
Well, simply go up a few stairs without being out of breath. I mean, just the little things you forget that were kind of a struggle. I mean, just simple things have been so much easier, weighing a little bit less from an activity standpoint, but overall, generally, emotionally, mentally, I just feel much more comfortable, much more confident. It's been a wonderful change for me.
Dr. Gray has been doing bariatric surgery at PMC for a little over 4 years. He is very passionate about helping people realize their dreams of losing weight and getting healthy.
This is really good for patients who are suffering from significant weight problems. Most of my patients are 50 to 100 pounds overweight, and most of them are suffering from medical problems like diabetes, high blood pressure, cholesterol problems, the things that will lead to coronary artery disease, which is essentially heart attacks and strokes and things like that.
Bariatric surgery isn't for everyone, and it is just one step in the process. Patients have to dedicate themselves to living a healthier lifestyle, and the Weight Management Institute is what keeps them on track.
The surgical portion is not just something that you do and then you're fixed. The surgical portion is a lifetime commitment. It's a lifestyle change. And yes, the surgery will get you where you want to be, but you have to be mentally prepared and emotionally prepared and physically prepared to the changes that are going to take place so that you can be successful long term. And other programs that don't prepare you in that manner can have a significant failure rate. At our program, we don't have a failure rate. All of our patients, every single one of them since I've been here, have been highly successful, lifelong.
Rick says that the reactions from his old friends are just one of the positive outcomes of the new and improved him.
It's been amazing. I haven't posted any pictures on Facebook, so it's been kind of fun to throw out a picture there and get some reactions from folks that I haven't seen or talked to for a long time. I have family all over the country, and so with reunions and gatherings and things like that, it's been neat for them to see me, and then friends, of course, and even in your own hometown, you don't see folks for months at a time, and I've had good results, and so it's been neat to run into them and have them say, "What have you been doing?" and what did you do this time? And so it's been neat to talk about the program and what it's done.
Information on free discovery seminars can be found on our website or by calling the Institute at 239-2620. The wound and hyperbaric treatment at PMC is helping people heal through a treatment that uses concentrated amounts of oxygen. The center has such incredible success that it's been recognized nationally. Kay Hunter is a patient who suffered from 2 wounds on her feet. After treatments at Portnoy's Wound and Hyperbaric Center, she is now healed and on her way to a normal life.
It means that if we want to go someplace, we can. We're not tied down to having to be in Pocatello and not being able to go somewhere else. And I feel so much better when my feet are healed.
Dr. Jared Price is a board-certified physician who specializes in wound care and hyperbaric treatment.
I think one of the key things that we do here is take a holistic approach to the patient's wound. So it's not about just what's going on with the ulcer on their foot. It's how is their diabetes, how's their nutrition, what's their care like when they're not here at the wound center, how can we help best to promote an overall picture that's going to allow that wound to heal.
The chambers are where the healing takes place. Patients spend 2 hours resting or watching television while the oxygen goes to work.
The hyperbaric oxygen chamber is it's a tube that we can compress the oxygen to a level of 2 atmospheres. And by doing that, it allows the lungs to absorb more oxygen, which then transports to the blood that has more oxygen, and that gets transported to the wounds and helps with the healing process.
So this is from the inside out?
Correct. Yeah, it's not a treatment that comes from the surface. It's actually breathing in that compressed oxygen that is then absorbed into the body and transported to the wound.
Having wounds heal is the goal at the center, and Kay can't say enough about Dr. Price and the staff.
He's the best. I absolutely love Dr. Price. He's fantastic. He he lets me be involved. He asks me, you know, if I have concerns, is there anything I want to ask him? And I wasn't used to that. I wasn't used to being involved in my care. And, you know, if I have a question or if I have a concern that comes up, I mean, he takes the time to listen to me and explain things for me. And overall, the entire facility, the staff, they make me feel like I'm not just a name or a number on a chart. They make me feel like they really care about getting me healed up and having me feel better.
For more information on our wound and hyperbaric clinic, call 239-2670 or visit our website. And we'll be right back.
Hi, my name is Nicole Baldwin. I'm the Safety Director Hyperbaric Technician here at Portneuf Wound Care and Hyperbarics. I was asked why I love my job, and a big reason why I love my job is instead of the fast-paced in and out with patients, I get to spend every day 2 hours a day with the same patient for about 2 months, and so I get to know them, I get to know their family, and that is something that I view as extremely important. Not a lot of people get that opportunity to actually get to know them, and not only their struggles that they're dealing with here. For here it's a wound, they're dealing with a wound, but you also get to know their struggles like at home and see if you can just be that listening ear for them at times. And so that is something I extremely love about my job here. My name is Nicole Baldwin, and I am proud to be Portneuf.
Hi, I'm Robert Archibald. I'm Core Lab Supervisor in the laboratory here. I've been here since 1997, and I really love my job because every day is a new adventure. There's not a boring day ever. No day is the same, and we do a lot of good things, but the reward is always, at the end of the day, a good feeling, a tired feeling of having done a lot of good things. I'm Robert Archibald, and I'm proud to be Portneuf.
I've never enjoyed doing anything as much as I do teaching dance and fitness class. My students provide me with such positive feedback, it's very inspiring. Not long ago, Dr. Blair had to do some serious work on my lower spine. He promised to come to my class when I was feeling better. Today, I get to work out his spine a little. I don't get to dance with Dr. Blair very often, but you know, without him, I'd never dance again.
My name is Todd Davis. I work in the pre-op department here at Portneuf Medical Center. I have this job because I like taking care of people and helping people. I've been doing this job for 5 years. My name is Todd Davis, and I am proud to be Portneuf.
Hi, my name is Gail Mikesell, and I'm a registered nurse at Portneuf Medical Center. My job is the Director of Education. What I love about my job is being able to educate and train staff so that they have the latest technology and education to take care of our patients. And I'm proud to be Portneuf.
Portneuf Medical Center is the first hospital in Idaho to replace a heart valve using cutting-edge technology called Medtronic Core Valve. Reporter Caitlin Lukita shows us why this makes such a difference for patients.
My heart was quitting. It was either that or die.
This is Donald Best only 4 days after he had a heart valve replaced.
I'm great. I feel good.
Best had congestive heart failure and severe lung damage, so he couldn't be operated on. Now, he's had surgery once before, which was a risky move.
You don't know what the hell's going on. I mean, the guys down there in L.A. told me that when they cut me open, they took my heart out of my body, fixed it. I don't know whether they did or not, but that's what they said.
Cardiologist Jacob De La Rosa says with this procedure you can go in while the patient is sleeping, and it only takes 45 minutes to replace the valve without even cutting into him.
This is the first one that's a self-deployable valve. So it deploys on its own as soon as you put it into the right position. So the advantages is that you can keep the heart beating as you're beating to be able to deploy the valve.
And he says there are risks to this procedure, but it's safer than open heart surgery with a quicker recovery time. So that way patients, such as Best, can enjoy spending more time with their families.
I don't want him forever, but at least another 20 years.
The heart program at PMC has been successful in treating patients for years and has great outcomes. In fact, the first open heart surgery patient still remembers his experience.
He said we would be teammates. And then if I did my part, then he would do his part. And he did. He performed a perfect, flawless surgery. It was absolutely wonderful. The whole team did. I ought to tell you about his PA, Jan Kohler. She's the one that was in the surgery, and she extracted the vein out of my leg that they cut to bypass the heart with. And she did what I think he said was a novel procedure. Rather than run a slit all the way down my leg and then pull the vein out, she just put a slit right up below my knee and a slit right down above my ankle, and then she slipped it out like a piece of spaghetti. Wow. And I've talked to lots of people who have had bypass surgery. Almost all of them will say that the leg incision is more painful than the chest incision. But I can truthfully say I've never had a moment's pain from my leg at all. I mean, it's just like it never happened. I mean, they are really professional and do a great job. I couldn't speak more highly of Dr. De La Rosa and his team.
For more information about heart valve replacement or our world-class heart program, visit our webpage at portmed.org. It isn't always a happy situation that brings people to the hospital, but on our labor and delivery floor, bringing new life into the world makes this floor one of the happiest. Jenny Lucy has more.
Having a baby is an experience you will never forget, and the labor and delivery nurses at Portneuf Medical Center, like Michelle Ferguson, know how important that is.
I feel like very few people get the opportunity to be in someone's life when they bring their baby into the world. You will never talk to a mom that won't be able to tell you how the birth of her baby went. Whether her daughter is 30, whether she's 50, every mother remembers the birth of their children. And we feel at Portneuf that it's an honor for us to be able to be part of somebody's birth experience. So we try to do that in a way that works for them. That's the best part of my job.
Portneuf Medical Center's labor and delivery floor rooms offer a warm and homey experience. You can feel comfortable, confident, and safe coming to PMC to have your baby.
We offer exceptional skill, but we also offer the best patient services and nursing care that you can imagine. We offer full services for anything that the woman would need, whether it's having a baby or a GYN care. We have nurses who have worked and dedicated their lives to women and children. We offer a full NICU. We can accept babies who are 28 weeks, 27 weeks with respiratory distress. We have neonatologists who are here to treat the most critical emergency that you can have.
The labor and delivery suites are set up for the feel of your own home so you feel the most comfortable while you're in labor.
Okay, let me show you our labor and delivery rooms. Come on in. The bed breaks into a labor bed, so the bottom half comes out, so you can labor the entire time, and then the bottom half of the bed comes off and it becomes a delivery table. All of our equipment is behind here to monitor your baby while you're in labor. We have central monitoring. So everything is set up and it's at the nurse's station. So if your nurse is in the room, you're being monitored, but if the nurse leaves the room to take care of someone else, you're being monitored as well. So it's all centralized monitoring.
One of the highlights of these rooms is the relaxing jetted tub. Although Portneuf doesn't do water deliveries, moms are able to relax while in labor and feel pampered during their stay.
The reason we decided to put these bathtubs in is it's hydrotherapy for pain control. So in the early stages of labor, we allow our moms to get in the bathtub. We have a waterproof monitor that we put on them, and they can labor in the tub.
Once your baby is here, they never need to leave your side. PMC has all of the equipment needed right in your room to make sure your baby is safe and comfortable.
The NICU staff attends every delivery, and we have a neonatologist that's also on staff and available 24/7, which makes most moms feel really relieved that it's a family-centered care, but if something arises, they have the help that they need.
And the newborn intensive care unit at PMC is ready with the specialty trained nurses and broad certified neonatologists ready to help if any baby is born premature or needs emergency care.
We actually train in the specialty of neonatology, which is basically from birth until kids are a couple months old, and or if they're born a couple months early, even all of those kids. So we specialize in all of those conditions that affect kids. We brought with us also some specialty with ventilator management, and we have started high-frequency oscillatory ventilation, which has just started in these last few months. That does allow some of the babies who were being shipped to other locations such as Salt Lake and Boise to stay here in Pocatello and actually get the care they need, and or get the care they need before we do need that specialty kind of step in to go to Salt Lake or go to Boise.
The staff in the labor and delivery department at PMC takes pride in what they do and feel it's an honor to be this part of someone's life.
We offer the very best care.
If you're pregnant, our free childbirth education classes are a must. To register and get more information, visit our website at portmed.org. Varicose veins, spider veins, you've heard these terms, but did you know that these common ailments can be a sign of bigger problems? Our vein center can diagnose and treat these ailments in one convenient location.
The Idaho Vein Center has a fully equipped procedure room and a comprehensive ultrasound suite that is on site, eliminating the hassle of going off-site for services. They also offer treatment for leg pain and swelling, arterial disease, and other vascular problems.
The patients that we see here in the Vein Center usually come complaining of symptoms in the legs. The most common one is pain. Other patients complain about edema, which is swelling of the legs. Others have trouble when they walk. The pain can be obvious at that time. And there are some other patients who have pain even when we're not doing anything, and that's called rest pain. Some of those symptoms can be caused by vein problems, but sometimes arterial problems of the arteries can cause that. When patients have these type of symptoms and they're interfering with their lifestyle, they are severe in nature, and the primary care physician also has evaluated them, they could consider coming to our center for further evaluation, and we can figure it out.
In many cases of leg vein disease, what is seen on the surface of the skin is not indicative of what is happening underneath the surface. Small spider veins at the base of the leg may actually be caused by larger veins higher in the leg that cannot be seen. This is why it's important to meet with a doctor who utilizes ultrasound to accurately diagnose the condition so that you can receive treatment that will provide long-term results.
We strive to offer the best quality of care that we can ever provide to any patient that comes to our center. And when you come to our center, you should expect that you will be treated like a member of our family. We'll do the best we can for you. And we also consider ourselves a one-stop shop. That means that when you come here, we'll evaluate you from the clinical standpoint, meaning asking for the type of symptoms that you have. We'll examine you. And then after that, if needed, during the same visit, we can only offer you an ultrasound of your veins, of your arteries, that will help us determine exactly what's going on. And then based on that, we can offer you therapy, or at least give you a plan for treatment during the same visit.
The Idaho Vein Center uses the latest technology to remove varicose veins and spider veins with great success and minimal discomfort.
For a typical patient with vein problems that we see, and I'm going to describe probably a typical patient that we see that have symptoms that are severe enough to interfere with their lifestyle, they usually have varicose veins that you can see. You can palpate them, you can feel them. They complain of pain in the legs, some swelling, and other symptoms such as aching, itching, numbness. Some people feel heaviness in the legs. If we determine after clinical evaluation that includes physical exam and the ultrasound that we do that the patient has severe venous insufficiency, we can offer procedures such as endovenous laser ablation with laser here in the office, in the vein center. We can also do ambulatory phlebectomy, meaning giving local anesthesia and removing veins that are bulging, varicose veins that are causing the symptoms. You can also inject the veins that are causing you discomfort with medications that are approved by the FDA for this purpose. Most people I would say probably 70 to 80% get relief of all the symptoms that I mentioned after these procedures.
For more information about the Vein Center, call 239-1650. We'll be right back.
My name is Lisa Hansen. I'm a physician assistant at the Idaho Vein Center, and I love my job because I love taking care of patients and seeing results. I like seeing the smile on their face when they leave, knowing that we've done a good job and we have fully treated the concerns that they had when they came in the clinic. I'm Lisa Hansen, and I'm proud to be Portneuf.
My name is Susie Berger, and I work in the same-day surgery department at Portneuf Medical Center. I've been in nursing for 15 years, and I find it very rewarding to take care of somebody else. My name is Susie Berger, and I'm proud to be Portneuf.
Trauma 1, emergency room 17, estimated time of arrival 5 minutes. Trauma 1,
he is coming by helicopter. They do not have an airway. He's on a backboard with a seat collar. I don't know about.
These are the kind of folks you want around when you've had a bad day. This is Trauma Center care at its best. Portneuf Medical Center.
My name's Barbara Mahoney. I've worked at Portneuf Medical Center for 31 very good years. I supervise microbiology. I'm a medical technologist. I also supervise our lab assistants that draw your blood and our outpatient draw station where they also draw your blood. And I love working with the people in the laboratory. I enjoy our outpatients. I enjoy our inpatients. It's just a very good career that I've enjoyed for a lot of years. I'm Barbara Mahoney, and I'm proud to be Portneuf.
Hello, my name is Sophie Barkdahl, and I am an administrative assistant in facilities. And I love my job because I love the variety and helping people. We have great people here at PMC. I'm Sophie Barkdahl, and I'm proud to be Portneuf.
A new lease on life. That is how one patient describes her experience after a heart transplant. Organ donation is not always an enjoyable or comfortable subject to talk about, but for those who receive the donation, it is a miracle.
Sarah Brown was born with a lot of heart problems.
It was hooked up really weird. I had like holes in my heart. I was born without a left ventricle.
And more. It was April of 2013 when that was fixed. Mostly. Her body started rejecting her new heart, so she had to take medications that suppressed her immune system, leaving her vulnerable to illness.
Not as much anymore because I'm on the lower doses, but I still have to be careful.
But getting the transplant at Portneuf Medical Center took a lot of coordination, which is why the hospital staff was awarded today.
This year we wanted to make sure the staff here at the hospital were able to see some of the outcomes and the benefit of that and thank them for all the work that they do.
And while she's grateful for the staff, Brown says ever since she received her heart, she's thought about meeting the family of the person who gave her a second chance at life.
So it could have been a high school kid or a newlywed or a new mom or a new dad, or it's not a good story of how they died. And so part of me thinks, yes, I'm ready, I'd like to know, but at the same time, I don't want to know.
Now, this award lasts for 2 years, and Portneuf has received it twice, and Portneuf Medical Center is the only hospital in eastern Idaho to receive this award. The other two are in Boise. At Portneuf Medical Center, I'm Chris Cole.
More information about the Intermountain Organ Donation Organization can be found on their website at idslife.org. PMC is proud to make your experience here as comfortable and safe as possible. And one way we do that starts before you ever enter the facility.
Shuttle service drivers comb the parking lots at Portneuf Medical Center in search of people who need a ride or just information on where to go. It is a free service and is available by calling the shuttle service number. Most of the drivers are volunteers who love their assignment and also help with other transport duties at the hospital. More recently, PMC has started a valet service that is available right at the main entrance of the hospital. Pull up and a driver takes your car. When you're ready to leave, your car is brought back to you and you're ready to go. This service is also free and available by calling the valet service number.
To arrange for a shuttle or valet, call 244-4279. Rarely do people rave about the food when they stay in the hospital, but at Portneuf Medical Center, that happens often. Our nutrition team is proud of what they do, and they love their job.
I love to cook. That is one of my passions that I do. I've been cooking for a lot of years, and one of the joys I love to do here at Portneuf is to cook for the patients.
Alma Brown has been in the kitchen at Portneuf Medical Center for over 10 years, and she takes great pride in her work and the comments she hears about her food.
Really good, because it's always nice to know how they feel about their foods when they go to the room, because I really don't see it myself, but when I'm preparing it, I just hope, because I'm fixing it from my heart, so when it leaves the room service line, I hope, there's a response from what I've cooked.
And it isn't just the good cooking that pleases the patients here. The room service makes their stay even more comfortable. It starts with a phone call from the patient that is answered by a food service specialist. They take the order and then the preparation begins.
Nutrition.
Our patients really enjoy our room service setting and the room service program that we have. In a room service program, they're allowed to order what they'd like that's within their diet, and they can tell us when they'd like it delivered, and we're able to individualize what they'd like, only send them what they'd like, and they can order as many times as they'd like as long as it's allowed in their diet. And I think the personalized touch of having someone from our department actually come and pass their tray to them and make sure that they've got everything and that they're ready to eat really adds to the whole experience.
I absolutely love my job. I love being able to bring a smile to the patients. It just makes my day when I can walk in and know somebody is not feeling well, but I can make them smile and give that just brings a bright spot to my day.
Over 1,000 meals are prepared each day, and yet the satisfaction scores are high and the safety ratings are even higher. But for Alma, it isn't the number of meals, but the care she takes with each one that matters.
I really enjoy it. It's in the heart, my cooking. I really do, because I think of it as if I was here, or a family or a friend. So when I cook, it is from the bottom of my heart.
Menus can be found in all the rooms or by asking your nurse. The Portneuf Health Trust is a community benefit organization that is dedicated to helping improve the health of our community. The partnership with the hospital is a unique and successful way for the hospital to give back. Jenny Lucy has more.
The Portneuf Wellness Complex is Eastern Idaho's largest and most comprehensive community recreation facility. It will host concerts in the large amphitheater. There will be sand volleyball, soccer, and football tournaments. There is a fishing pond, mountain bike and running trails, and much more. It is for all ages to enjoy, and the goal is to enhance the health in our community.
The Portneuf Health Trust was established to really improve health in our community. We've made many investments over the years to that end. Things such as an off-road ambulance, investments in the Pocatello Free Clinic, and then our signature product, the Portneuf Wellness Complex. The Portneuf Wellness Complex is established to really enhance activity in our community. It's for all ages, all abilities, and really all economic levels. We really hope that this community really benefits from this and uses this to improve their health in our town.
The Portneuf Health Trust Board is composed of smart, competent individuals from our very own community. They care for this complex and treat it as their own because it is their own.
The hospital is actually governed by a joint venture which is made up of the ownership of the Portneuf Health Trust. We have actually 7 members on that board, and LHB Hospital Group in Texas. They have 5 members, and that board is really tasked with approving the strategic vision and plan for the hospital, and also around approving budgets and developing budgets for the hospital. So it's just nice to know that the people from our community have a say and help develop those budgets and priorities that really serve the folks in our community.
For more information about the Portneuf Health Trust, visit the website at portneufhealthtrust.org. We'll be right back.
I'm Rhonda Fresh. I work production in food services. I've been here 8 months, and I love that the customers get to choose their own food. That they don't have a standard menu, they can choose what they want. I'm Rhonda Fresh, and I'm proud to be Portneuf.
Hi, my name is Juanita Grimmett. I have been at Portneuf Hospital for 44 years, and I work in mammography. I love my job because I help the ladies get their mammograms, help with biopsies, and make sure that they are well taken care of. My name is Juanita, and I'm proud to be Portneuf.
Hi, my name is Sharon Corrington. I'm in the mammography department. I've been here at the hospital for over 6 years, and we have an amazing staff back here, and that's why I love to work back here. They're great and they're very efficient. They get the patient back so fast and they're so friendly, and that's why I love it here. I'm Sharon Corrington, and I'm proud to be Portneuf.
I've been riding motocross since I was 4. Not long ago, I was in a practice round and took a long jump. Halfway through, I had that sinking feeling that I'd come up a little short. Fortunately, Dr. Ford was there to catch me when I landed. He fixed my broken ankle. Today, it's my turn to show him how I operate. I don't get to ride with Dr. Ford very often, but you know, without him, I'd never ride again.
Hi, I'm Brian Laws. I'm a registered nurse here at Portneuf Medical Center. I work in surgery and I'm the clinical lead. I've been here at Portneuf for 6 years, and I've been a nurse for almost 20, and I love what I do. As a clinical lead in surgery, it's my job to make sure that our surgical schedule runs quickly and efficiently so that my patients are in on time without delay. And I'm proud to be Portneuf.
For athletes, wellness off the field is just as important as wellness on the field. That is why Portneuf Medical Center has partnered with the school district for a sports medicine program unlike any other. Chris Cole has more.
We feel a need to have a strong affiliation with our local medical center.
Pocatello-Chubbuck School District Superintendent Mary Wagner announced the Portneuf Medical Center partnership at tonight's school board meeting. She says with funding always an issue, the deal is a welcome relief to the students and parents.
Our kids are doing a great deal of fundraising, and in most cases parents end up buying what kids have to fundraise for, and so it is an extra help on cash flow at home.
And as for the doctors who will be providing the services, they have years of experience and have been helping the high school athletes already.
Several years ago we had a pretty good program, but then a lot of the funding had gotten pulled, and so that's what's really been the impetus to drive this program.
Watney says he cares about the student athletes and feels the team of experts they've brought together provide the best care.
This program, once it's in full action, which it's being implemented now, is unmatched throughout the state.
And as for the money donated, one of the main uses for the money is to help with the cost of using Holt Arena.
So the hospital volunteered to put money towards that, as well as money towards the employment of another athletic trainer, as well as money for supplies.
Which makes this whole deal worth between $60,000 and $70,000.
We've only been in school for a few weeks, and kids have been practicing for about a month. But we've been grateful that we've had athletic training services because the trainers have been used.
Not only does PMC give thousands of dollars to the school district, they also supply free sports physicals for all high school athletes. When you receive a diagnosis of cancer, getting the right treatment and care is vital. And being able to stay close to home, where you have the support of family and friends, is even more important. That is why Portneuf Cancer Center is so vital.
Jenny Adams is the nurse navigator at PMC's Cancer Center. She sees what an impact Portneuf's comprehensive approach to care has on cancer patients.
But at Portneuf you have all of the subspecialties, all of the support services under one roof. It's one stop.
And what does that mean for patients?
That means they only have one appointment that they go to in one building. They don't have to go to several different appointments all over town. They get their everything from their labs drawn here to their planning for their therapies and receive both their therapies here.
Portneuf's Cancer Center is state-of-the-art and follows the same protocols as the leading cancer centers in the country. That allows patients to stay close to home and family.
When it comes to the travel, that can increase their fatigue. The cost, it's a burden. They have to have somebody drive them. Usually going to the bigger city causes more stress on the patient. So being able to be at home, sleeping in your own bed, you're going to do better.
Our radiation and medical oncologists are world-class physicians, and the nurses and staff are experienced and compassionate. A patient talks about his experience at Portneuf.
I've never had the service that I've had here at Portneuf, the hospital and the cancer center. These are dedicated people who want you to live, and they do everything in their power to help you live. You know, they make you treat you like you're part of their family.
So wonderful.
And I'll never forget these people here, and I'll always stay in touch with them.
The Cancer Center also offers a joint breast cancer program that allows women who are newly diagnosed to see all 3 physicians at one time instead of making multiple appointments. Breast cancer is something that 1 in 8 women will be diagnosed with. Each fall, Portneuf Medical Center holds an event called Break for Breakfast, where thousands of people line up to receive crucial breast cancer information, a gift, and of course, a free breakfast. Well, our most recent Break for Breakfast, we decided to get the whole hospital involved to celebrate those who have survived.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along.
We hope you've enjoyed this edition of PMC TV. And more importantly, we hope you enjoy your experience at Portneuf Medical Center.